A very good afternoon and welcome to the session on the topic preterm care. We are glad to have Dr. Alok Gupta among us today to help us understand the topic. The doctor will take us through that more in the session today. Also, be sharing all the important details and information regarding to the topic. Also, if you have any doubts, any queries, post us on the comment section. The doctor will take all your questions by the last of the session. So stay tuned till the last. Now, doctor, you have the stage.
Good afternoon, everyone. My name is Dr. Alok Gupta. I am consultant pediatrician neonatologist at Apollo Clinic, Greater Noida. Today, we will talk about the topic preterm care. First, we will discuss this topic under following headings like what is preterm, then what are the implications of preterm delivery, and how we manage preterm at hospital, and most importantly, how the parents manage the preterm baby at home. The first, we will know what is preterm. Preterm is delivery is the happens when the labor occurs less than 37 week of gestation. Normal gestation period is more than 37 week. If it occurs less than 37 week, we will known as premature delivery or preterm delivery. There are many causes of preterm delivery, like multiple gestation, in case of twin deliveries, in case of triplets, whenever there is infection in the mother at the time of delivery, there is bleeding in uterus, there is uncontrolled diabetes mellitus in the mother, uncontrolled blood pressure in the mother, or premature rupture of membrane in the mother, that can cause preterm delivery. So, so how we divide this preterm delivery? Preterm delivery divided into two parts. Less than 28 week gestation is known as extreme preterm. More than 28 to 37 week of gestation is known as the moderate and the late preterm. So earlier the baby is born, lesser is the weight, more premature is the baby, and there are more chances of complication as well. So, if any baby which is born 27-week gestation as compared to 33 week of gestation, the baby who is born at 27 week of gestation will have more complications, more longer hospital stay, and more chances of infection in that baby as compared to the baby which is born at 33 week of age, which will have more weight, less complications, less hospital duration, and more chance of survival as compared to the baby who is 27 week of gestation. So, what are the common issues during the preterm birth? There are many issues. These depend upon the degree of prematurity, as I discussed just. Common issues are basically we will first is the we have trouble in the breathing because in premature birth the lung is not able to expand properly, so the baby have trouble in the breathing. There is no respiratory distress syndrome, and for this baby may need surfactant, it is a chemical which provides the baby after birth if baby have difficulty in the breathing. Baby have baby may need various mode of ventilation like CPAP, mechanical ventilation depending upon the difficulty in breathing. This baby have trouble keeping warm, so this baby frequently require radiant warmer. Radiant warmers are basically automatic heaters, and this baby, if less than 1 kg, are also required incubators to keep them warm so that they are they may not become cold. Third is the heart problem. This baby has many heart problems known as congenital heart disease like PDA, patent ductal arteriosus are most common of them. So in case of preterm baby, we usually do echocardiogram at the age of 7 day. Earlier, if baby is sick and baby is not able to breathe properly and there is abnormal heart sounds present, we can do earlier as well. Like PD, there are many heart problems this baby can have. Then infection is a very common complication in preterm baby because this baby have innate immunity is just close to zero, so this baby has more chances of getting infection. So in our NICU, we maintain strict asepsis routine like frequent hand washing, use of maximum sterile barrier, and whenever we are touching the baby, we make sure our hands are clean, and we tend to decrease the intervention up to the minimum. So we have to decrease touching of the baby up to the minimum. Third is the digestive system. The baby has immature digestive system, so the baby usually have diarrhea, vomiting, blood in the bowel or stool. There is one rare disease in this baby known as NEC, necrotizing enterocolitis of infancy. In this baby, intestine are not able to handle the milk which are given after birth, and the baby hospital dosage increases. They might need surgery as well. So, likewise, other system, digestive system is also very delicate thing in this baby. Third is the bleeding in the brain. Likewise, other system, a central nervous system of this baby are also immature, and bleeding in the brain is quite common in this baby because the membrane line in the brain is very delicate, and due to any activity like the vigorous registration at the time of birth or later on, this baby might bleed in the brain that lead to apnea and many other things. Then jaundice. The baby are very prone to jaundice as compared to term babies because there are two factors. First, immaturity of the liver in this baby. The baby was not able to handle the excess bilirubin which are produced due to blood degradation. The baby frequently need phototherapy to decrease the risk of jaundice. And the second next question is what treatment these babies need. Depending upon the how early the babies are born, the baby's treatment depend upon that. Like what is the weight at the time of birth, what is the status of the respiratory system, what is the status of the skin system, as well as the GIT. Depending upon these, we treat the baby depending upon the requirement of the babies. So babies which are less than 1 kg or less than 20 weeks of gestation, then they need more support like ventilator, incubator, surfactant therapy, intubation, phototherapy, antibiotics, likewise. While late preterm, the babies which are between 34 to 37 weeks of gestation, they need less intervention as compared to mature baby. So, the next question of parents is, will my baby have any long-term issues if baby is preterm? So this also depends upon the complication of the baby suffered in NICU. If the NICU stay is not troublesome, it was smooth, baby needed a ventilator, but within 2 or 3 days, baby came out and the breathing was normal. There are no chance of there is no infection in the during NICU stay. If baby was able to suck feed, there is no incidence of NEC, or there was no intracranial hemorrhage, intracranial bleeding, then the chance of long-term survival is very good. But there are some of the babies which are unfortunate and which go through such complication. So there are some complications which are seen in the long term way. First is cerebral palsy. The cerebral palsy is very common in babies which are premature and which need some amount of registration at time of birth, and which need long-term ventilation. Second is vision problem. Particularly the babies which are less than 30 weeks of gestation, they have difficulty in vision in little part of life. Usually we do the vision screening, also known as the ROP screening, at the age of 3 to 4 weeks, and thereafter, depending on the finding on the first vision screening, we advise the parents to do some ROP screening as well to decrease chances of this visual problem later on in life. Third is the brain problem. The chance of ADHD, attention deficit hyperactivity disorder, learning disorder, are more common in preterm babies as compared to term babies. Fourth is a growth problem. The baby usually have decreased height and decreased weight later on in life. Third is the fifth is the ongoing health issues like this baby get sick more often as compared to the term counterpart. We usually discharge this preterm baby when following scenarios are met. The weight is at least 1.8 kg. They do not need any oxygen dependency. There is no oxygen dependency. Maybe able to maintain oxygen on the room air. There is no active infection. Baby are able to take the feed orally, and mother is confident. Then we discharge these babies. Many of the parents have issues. How we manage these babies at home? The first issue is feeding. The feeding in these babies, when we will discharge 1.8 kg, we usually advise avoid breastfeed. Give the cutlery spoon feed. You can express the breast milk and give that breast milk with the cutlery spoon. We usually advise the HMF powder, which is protein rich powder, to mix in the breast milk. It increases the weight gain of the baby. When the baby becomes more than 2.2 kg, then breast milk can be started. Second, the most important thing is we do the to practice the kangaroo mother care. Kangaroo mother care is basically baby's right as well as the mother's delight. So kangaroo mother care is the best thing you can do for your baby, especially when your baby is preterm. This can be done at least when the baby gains at least 2 kg of weight. Father can also do the kangaroo mother care as well. In this baby, we keep the baby skin to skin contact between the breast of the mother, and we mother can cover herself with a blanket. In one session, at least 2 hours should be given, at least 2 sessions per day. If during kangaroo mother care, baby needs feed, mother can breastfeed baby as well. In this kangaroo mother care, all the senses of the baby is stimulated, whether visual sensation, auditory, gustatory, smell, brain, all the sensation of the baby become stimulated. Baby gains more weight. There is skin improved by bonding of the mother and the baby. Temperature of the baby become maintained. There is increased chance of breastfeeding and decreased chances of formula feeding. There is decreased risk of infection as well. Third question is bathing. So when you can bathe the baby, parents always ask. So during first month of life, we discourage the bathing in the preterm baby. Only sponging is good enough. You can do massage before the sponging in during the first month of life. Sweetland baby is not well matured in the first month of life, so you can avoid bathing in first month. You can do sponging in first month. Massage. The parents always ask how many times we do massage, which oil to use. You can do daily massage the baby before sponging the baby. Any oil can be used, especially coconut oil is good enough. Any baby mineral oil of any good brand you can use. But once you are choosing any brand, keep stick to it, because if baby skin is not attended to oil, you can continue it to do it. You can do massage at least twice a day also, but sponging should be done only once a day. Massage duration can be about 10 to 15 minute per day, and massage also increases the weight gain of the baby as well as increases parental bonding with the baby as well. Fifth is the developmental supportive care. Developmental supportive care is these are the activities which improve the brain of the baby, and it boosts the brain growth. So these are very important in for the long term outgrowth of the baby. So these can be mild music when the baby is awake, when you are massaging the baby. Second, you can talk to the baby. Third, we can touch the baby. Fourth, KMC. KMC is the most important part of developmental supportive care. Then One concept is family centered care. Family centered care is parents and the family are integral part of the care, in which the not only the mother, father can also help in day to day course of the baby, like changing diapers, massage, kangaroo father care. This can as well be done by the father as well. Really helps the mother, and it gives the much needed rest to the mother, which is very helpful for optimum breast milk output. Now, I would like to have any questions. Thank you and Happy New Year. Thank you.